covering major news across San Diego. 10 minutes of non-stop news starts now.
And we have much more ahead on 10 News at 5, including the effects of Demerol.
We talked to a pharmacist who tells us what the drug is used for and its possible effects.
And while fans prepare for another vigil in Los Angeles tonight, there are a lot of questions about the Demerol shot Michael Jackson reportedly was given shortly before his death.
Here to talk with us about that tonight is Dan Page, the director of pharmacy at Alvarado Hospital. Now, Mr. Page, could you explain to us exactly what Demerol is and what it's usually used for?
Well, it's a Schedule II narcotic for pain control. And when it's used in the hospital setting, etc., it's a perfectly safe medication, but it's not generally used in the outpatient setting unless the patient is terminally ill of some sort of disease, etc. But when used in the outpatient setting, it's not as easy to control the side effects, and that's one of the main issues with Demerol, and one of the reasons why many of the hospitals don't even use it any longer. I mean, it was developed in the 30s as a cardiac drug and found as one of the side effects to be a strong painkiller. And so the cardiac effects still remain even when the patients are given the med for pain control. It affects the heart. And so when the doses start to get to higher levels, as in many patients who are terminally ill, the cardiac effects start to take over. And the reason why the hospitals have chosen to give it up over the last 8 or 9 years is because the cardiac effects can actually cause death in some patients.
Can you explain the difference for us, the difference between cardiac arrest and a heart attack and the role that Demerol could play in that?
Well, cardiac arrest is generally the interruption of the electrical conduction in the heart. I mean, the heart is both electrical and muscle, mechanical. If the electrical conduction is interrupted, then the heart will stop beating because it has no stimulation for the muscles to contract. In a heart attack, it's generally the blood vessels are occluded in some fashion. Maybe the blood supply is being blocked by, cholesterol, those sorts of things. And so the blood supply slows down, so the heart muscle actually begins to die. That's different. I mean, in cardiogenic shock or cardiac arrest, it's generally an electrical interruption that stops the heart, and it's a very quick thing that occurs.
We're also hearing reports that he may have been addicted to OxyContin. How big of a role may that have played, possibly, that drug interaction?
Well, with OxyContin, anytime you give two medications for the same thing, you're asking for double the issues. OxyContin is actually a cleaner narcotic in the respect that it doesn't affect the heart, but it also doubles the effects on respiratory depression. So that can stop the breathing as well. And then, you get that dual action there. The OxyContin itself would cause respiratory depression in high doses, but for the average person who's receiving a regular dose on a regular basis, it's usually not an issue. But when you double dose with two different medications, and usually one is your regular level that controls the pain, and then the other one's for breakthrough. The Demerol might be for breakthrough. Then if you overdose or give too large of a dose of the Demerol, then you can double the effects and cause cardiogenic shock or respiratory depression.
Dan Page, thank you very much.
Thank you.
Oh, you're welcome.
Appreciate your time.